Okay, let's dive in.
Hmm.
We're looking at this practical framework for clinical education encounters, really focusing on how you, the learner, can sort of take the lead.
Exactly. And our main source here is this really useful PDF. It's from the PAEA's Committee on Clinical Education.
Ah, the SNO PPS one.
Yeah, SENNAP PPS, a six-step learner-centered approach to clinical education. And it really kind of flips the usual way of doing case presentations.
Okay, so our plan is to break SNO PPS down, figure out what it actually is, how it empowers you, the learner, and, why it makes those learning moments, well, better, more productive.
Definitely. So SNFEPS, it's an acronym, right? But it's really a six-step process that you use when you present a case. It's designed to put you in control.
Which is quite a shift, isn't it? Moving from just like listing facts to really thinking things through and saying what you need.
Precisely. Let's walk through the letters. First up is S.
Answer summarize.
Right. You give a brief summary, the patient's history, your findings. The source actually suggests keeping it pretty tight, maybe 1 to 3 minutes.
Okay, concise, like that example case they mentioned, Eric, with the knee pain.
Yeah, exactly. You'd cover the basic symptoms, how long, and maybe key things like no specific injury reported, just the core info.
Got it. The next is N.
N for narrow. So based on that summary, you narrow things down, pick maybe 2 or 3 differential diagnoses that seem most likely.
Ah, so you're already starting to analyze. For the Eric case, they suggested things like uh, juvenile idiopathic arthritis.
JIA, reactive arthritis, maybe injury even without a clear history. It forces you to prioritize right away.
Okay, then A.
A is for analyze. And this is really interesting. You don't just list the differentials. You talk through them out loud.
Thinking out loud.
Yeah, comparing, contrasting. Why is JIA high on your list for Eric? Maybe the swelling, the slow onset.
Yeah.
And why might reactive arthritis be less likely?
So it shows your reasoning.
Exactly.
Yeah.
And it also shows, maybe, where you're a bit unsure. It's revealing.
Okay, now the P. This sounds key for the learner-centered part, the first P.
Probe. P for probe. This is your chance. You ask the preceptor questions.
Ah, so you drive the questions.
Yes. About things you're uncertain about, or difficulties you had, or maybe other ideas you thought of but weren't sure. It's not waiting to be tested.
Right. Like the examples asking, should anything else be on the differential? Or maybe I wasn't sure about X.
Precisely. You're guiding the teaching towards your needs. It's active.
Okay, makes sense. Then the next P.
That's P for plan. After you've probed, you propose your management plan. What do you think should happen next for this patient?
Like for Eric, suggesting maybe an anti-inflammatory port or ordering that ANA test.
Exactly. It shows you're thinking about the next steps, the practical side.
And the final S?
S is for select. You select something specific from the case that you want to learn more about, a knowledge gap you identified.
Oh, okay. Like self-directed learning.
Hmm. For the Eric case, maybe you realize you want to really understand how the ANA test relates to monitoring JIA.
So you leave knowing your homework, basically.
You got it. You've identified your own learning objective.
And the preceptors roll through all this. They're not just sitting back.
Oh, definitely not. They're listening actively, guiding where needed, asking clarifying questions, maybe adding context, but they're using your summary, your analysis, your probing questions as the foundation for their teaching points.
It makes it much more of a conversation.
A focused dialogue, exactly.
So let's connect this back. Why is this SNAPPS approach so valuable for you listening?
Well, I think the main thing is it shifts you from being passive, just presenting information, to being really active. You're analyzing, questioning, structuring your thoughts during the interaction.
Yeah, it forces you to think on your feet, but in a structured way. And it highlights exactly where you need help, right? No more guessing from the preceptor.
Absolutely. It makes the whole thing way more efficient. You target your learning needs right there and then. You walk away with clear takeaways, not just, feedback like good presentation.
It's less about proving what you know, maybe, and more about figuring out what you don't know and asking for help.
That's a great way to put it. Summarize, narrow, analyze, probe, plan, select. It really is a kind of roadmap
A roadmap for taking charge of your learning in those moments.
and building those critical thinking and communication skills at the same time.
So, a final thought to leave you with. Think about your next clinical encounter, your next case presentation. How might using a structure like SNAPPS change how you prepare, but more importantly, how much you actually learn from that discussion? Could it make you a more active driver of your own education?